When looking around the environment, is Ozempic the right choice for me? Ozempic has been around for several years as a treatment for type 2 diabetes. In 2022, it began gaining prominence in the public consciousness. It became a social media phenomenon, with a wave of incredible people talking about weight loss with this medication. But after all, what is the face of Ozempic? The biggest corporate beneficiary of the medication's popularity has been Novo Nordisk. Ozempic's success has transformed Novo Nordisk into the largest company in Europe, with a valuation of $450 billion, surpassing competitors like AstraZeneca, GSK, Roche, and LVMH outside the pharmaceutical space. However, a new contender has entered the competition. Eli Lilly now also has a competing medication called Zepbound, which seems to be even more effective than Novo's drug and also a bit cheaper. This has triggered a real race between these two fierce competitors to see who will capture the largest share of this enormous market. The lingering question is, with the emergence of new medications, is the cake big enough for everyone? Both Ozempic and Wegovy have the same main ingredient, called semaglutide, a GLP-1 that mimics the GLP-1 hormone that the body naturally produces after eating. They slow gastric emptying, suppress appetite, and make you eat less. Researchers realized early on that weight loss would be a side effect of this type of medication. In 2021, semaglutide was approved for weight loss under the brand name Wegovy, turning it into something much more than just a treatment for diabetes. All these GLP-1 medications, Ozempic, Wegovy, Mounjaro, and Zepbound, have side effects. The most common are stomach issues, nausea, diarrhea, and vomiting, although Zepbound seems to have fewer side effects. The competition between Eli Lilly and Novo Nordisk is nothing new. Both companies released their first insulin products in 1923 and have dominated the diabetes space since then. With the rise of type 2 diabetes, the demand for medications has increased, and they are being tested in various other conditions such as sleep apnea and other obesity-related comorbidities. This could be one of the largest drug classes in terms of sales. In 2019, Lilly and Novo were valued comparably to the rest of the pharmaceutical industry. Since June 2021, when the FDA approved Wegovy, stock valuations have surged, tracking alongside companies like Apple. They are being valued based on how much they are likely to grow in the next few years, trading practically like technology companies, which is uncommon for major pharmaceutical companies. Another similarity with the technology market is the need for innovation to overcome competitive obstacles, such as patent expiration. Patents protect a drug from competition for a certain period, allowing the developer to recoup the investment in research and development. Drugs like these are just hitting the market now and are far from their peak sales potential. We haven't seen this much enthusiasm around a pharmaceutical product since Viagra. Ask your doctor about Viagra single packs. And it's interesting because Viagra was discovered in a similar way. Initially developed for heart conditions, they noticed it had other effects and then pursued it for erectile dysfunction. For drugs like Viagra, which are small molecules, they are easy to produce. When they lose patent expiration, they usually lose around 8% of sales in their first year. For GLP-1 drugs, which are larger molecules, production is more challenging, and the sales decline after patent expiration is much slower. Many other pharmaceutical companies are looking to enter this market now. Amgen is developing an injection that can be taken less frequently. This is the first time we have truly effective medications to treat obesity. Amid this potential sales bonanza, both Novo Nordisk and Eli Lilly are heavily investing in expanding capacity. However, currently, producing enough drugs has been a challenge. Do what needs to be done, but ensure that you reserve medication for those who truly need it. The demand for these products is so high that off-label usage is common, leading Novo to restrict lower doses of Wegovy in the U.S. to protect patients already on the medication. Another hurdle is reimbursement and cost. All the drugs are really expensive now, ranging up to $1,000 per month or more. Obesity, for a long time, was just considered a lifestyle choice. You'll lose weight if you eat less. We've seen how much money the diet industry makes in the United States, so only in the last decade has obesity been treated as an actual disease. Therefore, it hasn't been reimbursed well and has largely been a pay-out-of-pocket market. If you've never lived in a larger body, you have zero room to judge. You know, I've been covering the pharmaceutical industry for about 15 years, give or take, and I've never seen people so interested in a topic. When you talk to people about these drugs, they quickly ask, "Oh, do you think I need this?" It speaks to the consciousness that people have about their bodies in a really interesting way. The obesity market was worth $2.5 billion in 2022. We estimate that this market could exceed $80 billion by 2030, with relatively low penetration rates of around 11% of obese patients in the US being treated and about 6% in Europe. Novo and Lilly are really going to drive this space. Now that we have two competitors in this market, the trend is for the entire market to expand even further.